Hello, today I'll be talking about my educational infomercial, the fifth and sixth top 10 leading causes of death in the US. The fifth and sixth top 10 leading causes of death in the US. Number 5, stroke, cerebral vascular disease, responsible for 128,978 deaths. Number 6, Alzheimer's disease, responsible for 84,767 deaths. The fifth and sixth top leading causes of death to 18 and 24-year-olds in the U.S. Number 5 is heart disease, responsible for 941 deaths, and congenital anomalies, responsible for 362 deaths. A stroke occurs when there is a blockage in blood supply to the brain or when the blood vessel bursts, resulting in damaged or dead brain cells. Blood vessels in the brain are vital as they carry oxygen and nutrients to your brain. The two types of stroke that can occur are an ischemic occurs when there is a blood clot or other particles that block the blood vessel to the brain. A hemorrhagic one occurs when a blood vessel bursts in the brain, the buildup of the blood ruptures and it causes bleeding into the brain. There are signs and symptoms to look for when someone is having a stroke. Sudden numbness, weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding, and sudden trouble seeing in one or both eyes. Sudden trouble walking, loss of balance or coordination, and severe headache with no known cause. It is easy to use the word fast to remember these signs and symptoms. Face, look for an uneven smile. Arm, check if one arm is weak. Speech, listen for slurred speech. And time, call 911 at the first sign. Someone in the US has a stroke every 40 seconds, meaning every 4 minutes someone dies of a stroke. 87% of those strokes are ischemic, meaning blood flow to the brain is blocked. The risk of having a first stroke is twice as high for African Americans as for white races, and African Americans have the highest rate of death due to stroke. Death rates have declined for decades among all races and ethnicities, but Hispanics have seen an increase in death rates ever since. Yes, a stroke can be prevented by eating a healthy diet, maintaining a healthy weight, being physically active, not smoking, and limiting their alcohol consumption. Alzheimer's disease is the most common type of dementia involving the part of the brain that controls thought, memory, and language. It is a progressive disease, meaning it starts with a mild case of memory loss up to the loss of the ability to carry on a conversation with somebody. The image shows a brain, how it changes in Alzheimer's disease. On the left, the healthy brain, and on the right, severe Alzheimer's disease. In 2013, 5 million Americans were living with Alzheimer's. The symptoms can appear as early as 60 years old and only increases with age. African Americans are twice as likely to have Alzheimer's or other dementias as older whites, and Hispanics are 1.5 times as likely to have Alzheimer's or other dementias as older whites. In 2017, Alzheimer's cost Medicaid $3.46 billion. Alzheimer's has no cure, but the treatments cannot stop Alzheimer's from progressing, but it can improve quality of life for those with Alzheimer's as well as their family members, friends, and caregivers. Heart disease deaths in 18 to 24-year-olds refers to many types of heart conditions. Coronary artery disease is the most common and affects the blood flow to the heart. The image to the right shows the blood vessels and how little by little the constriction makes the blood vessels more narrow, affecting the blood flow. The non-modifiable risk factors, the things we know we cannot change: ethnicity, gender, age, and family history. Heart disease behaviors that we can change: an unhealthy diet, physical inactivity, too much alcohol, and tobacco use, which increases the risk very drastically. These are things we can change to reduce the risk of heart disease. And it's the leading cause of death for people of most ethnicities in the US, including African Americans, Hispanics, and whites. Lastly, congenital anomalies, deaths in 18 to 24-year-olds. These are also known as birth defects or congenital malformations. They can be found at birth and may continue through your adult life or be detected later. Most of these are caused by genetics or environmental risk factors. Some ethnic communities have a higher prevalence due to rare genetics or mutations. Some are like cystic fibrosis. Low income families are considered an indirect determinant. They serve 94% of severe anomalies due to the lack of access to sufficient nutritious foods, healthcare, and screenings. Thank you. I hope you enjoyed learning about strokes, heart disease, Alzheimer's, congenital anomalies, and wish you enjoyed the video as well. Thank you. Bye bye.